Do you know what cardiac amyloidosis is? A fascinating condition often referred to as stiff heart syndrome. This intricate disease sees amyloid deposits taking up residence in place of the healthy heart muscle. The result? A heart that becomes thick and unyielding. Over time, this can lead to a weakened heart and potentially pave the way to congestive heart failure. It is a globetrotter, affecting multiple organs such as the heart, liver, spleen, kidneys, digestive tract, brain, and nerves. It can wreak havoc on the kidneys, leading to an excess of protein in the urine. Let's talk types. Immunoglobulin, light chain, AL amyloidosis. This is the most common type of amyloidosis in developed countries. AL amyloidosis is also called primary amyloidosis. It usually affects the heart, kidneys, liver, and nerves. A amyloidosis. This type is also known as secondary amyloidosis. It's usually triggered by an inflammatory disease, such as rheumatoid arthritis. It most commonly affects the kidneys, liver, and spleen. Hereditary amyloidosis, familial amyloidosis. This inherited disorder often affects the nerves, heart, and kidneys. It most commonly happens when a protein made by your liver is abnormal. This protein is called transthyretin, wild-type amyloidosis. This variety has also been called senile systemic amyloidosis. It occurs when the TTR protein made by the liver is normal, but produces amyloid for unknown reasons. Wild-type amyloidosis tends to affect men over age 70 and often targets the heart. It can also cause carpal tunnel syndrome. You may not experience symptoms of amyloidosis until later in the course of the disease. Symptoms may vary depending on which organs are affected. Severe fatigue and weakness, shortness of breath, numbness, tingling or pain in the hands or feet, swelling of the ankles and legs, diarrhea, possibly with blood or constipation. An enlarged tongue, which sometimes looks rippled around its edge, skin changes such as thickening or easy bruising, and purplish patches around the eyes. Blood and urine may be analyzed for an abnormal protein that can indicate amyloidosis. Echo, MRI, and nuclear imaging are also done biopsy. A tissue sample can be checked for signs of amyloidosis. The biopsy may be taken from the fat under the skin on the abdomen or from bone marrow. Some people may need a biopsy of an affected organ, such as the liver or kidney. There's no cure for amyloidosis, but treatment can help manage signs and symptoms and limit further production of amyloid protein. Chemotherapy. Some cancer drugs are used in AL amyloidosis to stop the growth of abnormal cells that produce the protein that forms amyloid. Targeted therapies. For certain types of amyloidosis, drugs such as patisiran, onpatro, and inotersen, Tegsedi, can interfere with the commands sent by faulty genes that create amyloid. The heart. Amyloid reduces the heart's ability to fill with blood between heartbeats. Less blood is pumped with each beat. This can cause shortness of breath. If amyloidosis affects the heart's electrical system, it can cause heart rhythm problems. Amyloid-related heart problems can become life-threatening. The kidneys. Amyloid can harm the kidneys' filtering system. This affects their ability to remove waste products from the body. It can eventually cause kidney failure. The nervous system. Nerve damage can cause pain, numbness, or tingling of the fingers and feet. If amyloid affects the nerves that control bowel function, it can cause periods of alternating constipation and diarrhea.